For seniors and other people enrolled in Medicare, the open enrollment deadline is December 7th. And here to tell us why open enrollment is so important is Chris Abbott, a health plan CEO at United Healthcare. Good morning.
Good morning.
So let's start there, Chris. Let's talk about why this open enrollment is so important.
Well, you're right. It is very important. We're in the last few days of the annual Medicare open enrollment period. It runs through December 7th. That's Thursday. This is the opportunity when most Americans who are on Medicare have an opportunity to select their plan for 2018. We want to make sure that plan makes sense for both your healthcare, your wellness, and for your wallet. I don't want anybody to wake up on Friday morning without being in the right plan. So the goal is take action before the end of the day on Thursday.
Now, taking action, it can be very overwhelming for people. Any last minute advice on how to make sure you're making the right decisions and making this process easier for families?
Well, you're right. Medicare can feel confusing, but here's a couple of thoughts about the way I approach making a good decision. The first one is if you're on a plan today, look closely at that plan to make sure that it continues to meet your needs. If the plan changed or the circumstances of your life have changed, where you live, your finances, your health status, it may be a signal that you need to shop around. Take a look at whether the plan fits your budget. So that's not just looking at the premiums, which are important, but looking at the costs that you have to pay, you have to participate in when you get care. So the co-payment when you go to the doctor's office, or the co-payment when you get prescriptions at the pharmacy. Next, take a look at the medications that are part of that plan. Make sure the medications you're taking are included. Look at that formulary, that list of drugs. If there's an opportunity to get those medications at the lowest possible tier, that's a good thing. I would go ahead in that direction. Next, make sure that the doctors and hospitals that you prefer to see will be available to you with whatever plan that you select. Again, making sure you have access is another key element. If you're looking at a Medicare Advantage plan, pay attention to those additional benefits. So many people learn that traditional Medicare doesn't cover things like hearing aids, vision, dental, transportation. But guess what? Medicare Advantage plans frequently do. And if those things are of value to you, take a close look at those. And finally, access to well-being programs. So that could be a free fitness club membership, or it could be a visiting nurse, a house calls program as well. All of those things should be part of your decision process.
Well, and I'm glad you mentioned that Medicare Advantage program, because it seems like that is growing in popularity so much these days. Would you agree? Is this something people really need to consider?
Absolutely. We've seen 50% growth over the last 5 years of Medicare Advantage. Today, 1 out of 3 Americans on Medicare has selected a Medicare Advantage plan. And the reason why they do that, Medicare Advantage, by the way, part of Medicare, it's Medicare Part C, where we put A and B into a single program, is that Medicare Advantage is typically providing simplicity, value, convenience, and peace of mind, because again, all of those benefits are into a single program. Prescription drugs are typically built in. The premium for these plans is typically very low, or even as low as 0 in some cases. Those additional benefits are built in. But most importantly, there's financial protection for peace of mind. Traditional Medicare, there's no limit on what you might pay out of your pocket, but Medicare Advantage plans provide an out-of-pocket maximum that can protect your nest egg.
Well, the good news is here, there is still time to sign up. So if people have last-minute questions, where should they go today?
Well, you can go online right now at uhcmedicareplans.com. You can take a look at our entire portfolio of plans, make a good choice. But hey, we're almost at the end here. Give us a call, 1-800-UHC-6509. We can answer your questions. We can still probably get you in with an agent to meet over the kitchen table. But if you're ready, we can actually enroll you over the phone today.
Chris, we really appreciate you spending some time with us today. I know you are very busy these days, but it's an important time for a lot of families. So thank you so much. We appreciate it.
It's my pleasure. Thank you.